¿Empiezo ya? Okay. So, welcome. Good afternoon. Thank you so much for being here. I'm Dr. Esteban Emiliani. We're here from Fundación Puigverd. I'm here with Dr. Pedro Hernandez, who's my great resident, who is going to help me, and Laura also that it's going to help me as a nurse. So we're going to do a flexible urethropscopy today, and I want to thank especially Pusen for this opportunity and for giving us all the great material that I'm going to show you. So this is a case of a 39-year-old female patient with no relevant past medical history. This patient has a 14 millimeter stone in the mid anterior calyx that we'll see how we're going to manage that. And she had a renal colic because of a 1 centimeter stone in the left ureter that needed a double J to be placed. So we're going to start now. So for the flexible urethropscopy, as you can see here, I always place the patients in lithotomy position, always place the patients in the same way, C-arm on the right side, on the left side of the patient, and all the monitors on the right side of my patient. Always the same thing, always systematic to reduce complications, and so everybody's happy, everybody knows what they have to do exactly all the time. So we drape the patient, and I put this table next to me with just a basin with water. I only open one guide wire, my scissors, some wet gauzes, and the syringe, just to have some material. And I very much this table because I can put my instruments and manipulate myself. So I'm going to start with a semi-rigid urethropscopy. Firstly, to remove the double J. For this, I am using also a manual pump that I always use for my interventions. So let's start here. Okay. So everything has been pre-checked. We have done the timeout, the checklist, etc. I always like to start with a semi-rigid urethropscopy to remove the double J and even to check out the ureter always before placing urethral access sheet or even the scopes, because what I want is to avoid any damages to the ureter. I don't know if you saw that there's some incrustation inside the kidney. Let's take it out, and inside the stent, let's take it out and just see it either way, just to see what happens. So I grab it to the tip of the stent, I push it to the tip of my scope, and I remove it. You can see that here, remove this perfectly. Thank you. You can leave it. Sometimes what I do is just that I cut the tip of the stent, even if it's a little bit uncrusted. You can see here the color that it has been changing around the stent. This may probably be, can you leave this here? Thank you. This may probably be some infection. This patient had a positive urine culture, and we gave her 1 week antibiotics preoperatively. So I always like to start with a hydrophilic guide wire. Thank you. And to avoid any radiation exposure, what I do is that I feel what I'm doing. Once I feel the proximal coil, I just retrieve my stent. I'm reducing radiation exposure like this. I grab it with my fingernails and I remove it. So I know that my guide wire, as I felt, and for tactile feedback, should be in the kidney, and also because the tip of my guide wire is at the tip of my table, so most probably will be in the kidney. What I do is that I put this safety guide wire on the coil again, and I just tape it on the left side of the patient, always on the left side of the patient. So I tape it like this. Okay, that's good. ¿Me das el Pusen, por favor? We're going to open the flexible ureteroscope now, the Pusen 7.5. This is an excellent single-use scope. You can see how my nurse is going to open it. It's very easy, and it brings all the good advantages of single-use scopes. Firstly, it's brand new, as you can see now. So there's no damages to the tip. There's no damages to the deflection mechanism. It's a 270 degrees deflection, both sides. So it's great. So it's very easy to handle. It comes in a very big pack, in a very light package. You just open it and you have a brand new scope. Also, the other great advantage, of course, is that it's completely sterile. Now that we have this, thank you, it's completely sterile. Now that we have a positive urine culture, we will benefit from the sterility of this patient. We gave her 1 week preoperative antibiotics, but we benefit from this. So as you can see here, podemos conectar aspiración, por favor. So this is, the Pusen is 7.5 French. It has bilateral deflection. Yeah. So this Pusen has an inner channel to put the irrigation here. Working channel is already here, so we need to remove this. And this special button is for aspiration. So this is this device for in-suction device. We're going to connect some aspiration here that is going to be used if needed. So the ureteroscope is plug and play. We just leave it here to my staff, and you can see there is just plug it. And it's going to, perfect. Puedes poner swap, por favor. Sí, sí, excelente. And we're going to connect the aspiration here. Puedes poner swap, el botón de abajo, de abajo. Ahí, swap, exacto. Y ahora pip pop. Pip pop. Está en verde, ahí. Dale, otra vez. Excellent. So I'm going to put the ureteroscope in my whole screen. Me das una gasa, por favor. And I'm going to do white balance. ¿Me haces un balance de blancos, por favor? Balance de blancos. So remember, you have to do white balance. Okay. So 3 seconds with the button of the, perfect. 3 seconds of this first button that you have here in the disc scope, and you have the white balance. Agree. So we have, irrigation, in scope working channel. We put the aspiration. Remember that this is a 7.5 French scope, which is manual pump for my resident, sujeta acá. Remember, this is a 7.5 French scope and has a 3.6 French working channel, and the aspiration is on the working on the same working channel as for irrigation. So we're going to connect it, and we're going to see how it clears the view, which is one of the main advantages. Okay, so I'm going to get into the kidney. Fortunately, this patient was pre-stented, but remember that this 7.5 French is made evenly to go into ureters that are not pre-stented, so you can get an easy access, and to avoid any failure of accesses, which are small, less than 10%. Thank you, which are small, less than 10%, but with this 7.5, you reduce it at minimum, so there is no access failures. So the ureter looks good. Now you can see that the guide wire was well placed. We haven't done any um, any clear X-ray, just one to place the perfect one to place the catheter. So we have the lower pole stone here, looks like a struvite stone, perfect for this. Inferior calyx here, mid calyx. This kidney is like most kidneys, 60% of kidneys, a big lower calyx. You can see here the stand, and a big upper calyx. There's no mid calyx like 60% of the kidneys. So we have this upper pole. The guide wire is coiling, so excellent. So the first thing that I want to do is, ¿me das una cesta, por favor? Una cestilla, la 1.9 que está ahí, por favor. The first thing that I'm going to do is to... La 1.9 que está ahí, perfecto. Está bien. I'm going to grab this basket, I'm going to basket this, and I'm going to put it on the upper pole. I always like to relocate the stones. Just for a matter of good. And let's see if this comes out. So I grab it with 2 fingers here, and I put my basket. This is a 1.9 basket. It's good. I like this. I like this because then if there's something wrong, you can put your guide wire in here. Open the size of the stone, not too much. Open. Good. Close. Okay. It's too big. Open. Abre. Too big. Close. Open. Close. We just broke it. No. Too big and we are stuck now. Open. Ábrela. Okay, so we're going to move here. Open, close. Open. Now we're stuck now. It's okay. Let's try to make this movement. And if not, we're just going to put the fiber on in it, and we're going to break the stone in place. Abre bien, open, close, open. These 2 into the stone. Close. Okay. ¿Podemos abrir la fibra, por favor? Yes. That's perfect. Sí. So we're going to open 200 micron fiber. We're going to use a high power chromium laser here. So what I do is that I grab the fiber and I put it on the table to avoid any knots. That's good. I always grab the whole thing completely. Perfect. Aquí está. I give my nurse the last part. Yes. And I put some wet gauzes on the table to avoid any rippings of the laser. This is also why I put my chromium laser very close to the table to avoid any ripping of the laser. I don't want anyone passing or crossing the laser fiber and and giving me any problems with it. So this is how we uncoiled it to avoid any knots. And then I just cut always the tip. There's no reason to have a transparent tip. Gracias. ¿Me das la fibra? Okay, so I'm going to use a very long pulse modulation here, 0.7 joules and 12 hertz. This is good to start. To open here. Great. This is the good thing about having 3.6 channel with a 1.9 basket and a 200 micron laser fiber. You can put it together. Remember that the aspiration is on, but we have the working channel in use with the irrigation. Excellent. So we have there. Lo podemos poner en listo, por favor. So the idea now is to pump. Okay. We got very close to the stone. Abre, por favor. My resident is open it up. And then I just go close to the stone. Gracias. I have my pedal here underneath. And then I can just start the lasering. Dale. Con la bomba manual. A little bit too hard. This looks like an effective stone. Exactly. It's already cut in half. That's good. And once when what is cut even more, we can release the basket and just forget about it. ¿Me puedes poner, súbeme a más frecuencia? No, los hertz, eso, súbemelos, hay 20, eso. Y déjalo ahí, vale, ¿listo? Perfect, so now we are with long pulse or long pulse modulation, 0.6 and 20 hertz, so only 20 watts. This is really important because I know that 7-8, pompa por favor, 7-8 of energy is good. I know that I'm doing a good dusting here. You can see that. But what I want to do is always to keep low power on the kidney, low power on the kidney, less than 20. Maybe we can increase the energy. Sube la energía a 0.8, por favor. Eso. 0.8 sube. Okay, so 16. You see? 0.8, 20 hertz, and 16 watts. So less than 20. You see, it's a little bit better now. Less than 20 for the kidney, and less than, I will say, even 10 for the ureter to be very to be on the safe side. So we're dusting very well here. There's insuction now at this moment. So you can see here that there's a good and clear view all the time. This is good. Remember that we have two instruments on the working channel because we were stuck here. But this gives us the opportunity to aspirate. And have some passive aspiration. We will then have some aspiration without the irrigation initially. Without the irrigation. So the idea to be very efficient with um, the idea and to be very efficient with the dusting. Abre, cierra. Abre. I'm going to try to remove this. Cierra. Okay, great. So we remove the basket. You saw the trick to remove the basket. There's no need to worry. There's no need to be alarmed. You just use a proper basket of a proper size, and then you can just, if you're blocked, you can just put a 200 micron fiber along the working channel, along the basket, um, and just dust or fragment the stone to remove it as we did now. So I'm going to look for the stone. This was not the stone that we were treating right now. I think it was here, but it's pretty much, let's look for it. It's pretty much dusted, probably. Okay, so I'm going to work on this one. So this is a lower pulse stone. A little bit more difficult here. I think I'm having trouble because this is an inferior anterior calyx. Dame la cesta. I'm going to relocate this stone, which was the first idea. I'm going to keep the first idea, relocation of the stone has shown in randomized control trials that you have increased stone-free rates. So that's a good idea. Abre el tamaño de la cesta. Baja. Cierra. I always tell my resident to open the size of the stone. Cierra. The size of the stone. This is important. And then you give yourself some space. You see everything that you're doing. You don't put it too close to you. And then exactly what I do is that I push it to a more comfortable. Okay, a ver. To a more comfortable position. In this case, this calyx here, as I mentioned, to increase my stone-free rates. So the other thing that it's important is that you are comfortable, because one of the most difficult stones to treat are inferior anterior calyxes, as this one. The ideal is to have a working channel that goes out in front of the stone, but otherwise it is good to relocate and for you to be very, very comfortable. So I'm going to put all the stones in the same calyx. This is something that I like also, to control that I'm dusting everything. I have the aspiration on hand. You can see that visualization is good. I'm going to dust this stone, and these stones that breaks very easily, which are struvite stones, you may need to do some popcorning eventually, because they just break on the middle of the dusting, as you can see here. So the strategy again was to relocate the stones to a non-inferior calyx where all the stones were, as you can see here. And with this, it was good to have all the stones in the same calyx, to dust and control them. I like to dust, especially when you have suction devices. These aspiration devices will give us the opportunity to increase stone-free rate, reduce increased pressures on the kidney. We really need to start doing some research and knowing how this influence patients, but we already, let's say, have a sense and know that it's going to work. You know that the most important causing factor of complications in flexible ureteroscopy is precisely increased pressure. So what you need here is a good laser that you can, where you can dust. ¿Me puedes subir a uno, por favor? So this is, gracias. So I was saying that it was a little bit difficult to dust. Gracias. I'm going to use 1 joule, 20 hertz, so 20 watts. This will increase my power for popcorning. This is my maximum setting. This is my maximum power of setting. And this will make a good popcorning. So what I was saying is that you need a good laser to have a very thin dust. There's no definition, clear definition of dust. What is commonly used is 250 microns because it's what it fits on the working channel. Is the smallest particle that you can fit on a working channel that is not going to collapse this channel. So now we have a good energy with this long pulse modulation and a good frequency. I'm feeling very comfortable with the dusting of this stone. So the stone was 1.5 centimeters. I think it's a mixed stone. We'll figure that out at the end. With some analysis, we like to analyze the stone always to give the patient some kind of recommendation to avoid recurrences. This is not only about taking out the stones, but also to treat the patient to avoid any recurrences. Excellent. So I think we're doing a good job here. We need to popcorn a little bit more, but the stones that break up very easily just need some timing. We can aspirate at some point here while we're working. I'm gonna stop the irrigation and do some aspiration. ¿Me puedes subir la aspiración un poco, por favor? You can see that there's some particles coming. The irrigation is closing. They're gonna increase my aspiration, so we can do it later on. But I'm going to continue to do this popcorning for the moment. So the other good thing that I like here, gracias, Fernando, is to have my laser fiber 1/3 of the screen. You can see here that it's just 1/3 of the screen, which for me is the best compromise we have published on this between safety and maneuverability. Is the better compromise. You can see here is 1/3 of the screen. You decrease if you have a lot of fiber on the screen, you may be more keen to touch the mucosa, and if you have less, well, you have more control. So this is, I think, the perfect one. Okay. So we are almost done here. We're almost done here. I'm going to para. No rompes más. So for the last bit of the popcorning, what I like is just to have gravity irrigation, not more. I don't want manual pump because I don't want the fragments to go away from the tip of my fiber. Remember that popcorning is not done by the stones hitting themselves. but by the stone hitting the tip of the fiber. So you need always to have the stones very close to the fiber. I think we're done a pretty good job. Remember that the fiber is 200 microns, and we have now stones of less, or the fragments may be less than the fiber, so less than 0.2 millimeters. So this is going to be very well expelled. I'm going to close the irrigation here, and I'm going to try to aspirate some of the debris here. You can see what may aspirate here a little bit. Excellent. So a little bit, I'm a little bit perfectionist. So I want the patient to have only dust, real dust. I'm going to ask for a double J stent because this patient had a positive urine culture and a struvite stone probably, so I wouldn't left her with a single J stent, even if she was pre-stented. This is completely debatable. There's no evidence. The surgery went well. It has been very quick. You can see that the Pusen has a timer there. We're not even half an hour in, and it's going to be a half an hour surgery. But as this patient has a positive urine culture, antibiotics, struvite stone, I just rather not have increased pressure at any time, and I rather her to have a double J stent in place for at least 1 week. ¿Me abres un doble J siliconado del 24? Sí, silicona. So I'm going to place a double J stent, 24 French, at 6 French, 24 centimeters. This patient is not too tall. I always like silicone stents to decrease, to try to decrease symptoms in patients, in patients. You can aspirate a little bit some debris. Pompa, por favor. Pompa, pompa, pompa. So I'm going to flush the dust outside of the lower pole. I'm going to continue to do this. Vale, para. Pompa, pompa, pompa otra vez. I'm going to flush it. Flush, 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 flush. Sí, por favor. And my nurse is asking if we are going to leave a Foley's catheter, and yes, always to reduce pressure. Pompa, pompa otra vez, por favor. Dale más. Vale. Okay. So I think we have treated very well the stone. It's just dust here. I'm going to do some last evaluation here. Upper pole, no fragments, just the coil. Lower pole. mid, mid lower, just minimal debris here. Some of the debris on the lower palm. Dame una cesta, por favor. I'm going to try to grab one of these small bites for analysis. You need a 1 millimeter stone to have a good analysis. So we always wait till the end to do this. So remember, working channel is at 3 o'clock. Abre un poco. We have very small piece. Cierra, cierra, siempre abre un poquito, un poco. Cierra. Perfect. Okay, so we remove it quickly. Abre. So with this, we're going to do the analysis. Excellent, we remove it. And we're going in again very quickly just to do this last evaluation. So we go in as with any other stent, any other urethroskop, and we just look for the orifice here. See, the orifice is very wide. Sometimes the guide wire just bothers you for this. Let's try this angle. Yep. Almost. Bladder must be very full, so we have some trouble getting in. Yeah. I'm going to remove my guide wire. There's no trouble. We have no problems with the ureter. Look for it. Dame la guía. So we put this on the table. Excellent. We see it's organized. We're going to use the guide wire to get in. Excellent. ¿Tienes? Vale. Voy a entrar otra vez. I'm going to get in with the guide wire that we had, just to avoid. Excellent. Excellent. So if you ever have trouble getting in the ureter, this can be a good trick to use. So we go to the neck. We look for the orifice here. Again. and then you use the guide wire to get in. That's the trick. And we'll leave the guide wiring at the end. But that's the trick if you have some difficulties to get in. You can see the dust coming already from the ureter. So it's already clearing. I wanna have a last look up. Al siguiente. And I'm going to tell Pedro to just pump a little bit at the end. I really like what I see. This is the lower calyx, mid calyx here. Pum, 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 pum. So everything clears. This is really these are less than dame la láser por favor. This is less than 0.2 millimeters. I'm going to dust everything here. Just dust in the upper pole. I'm going to do just a little bit of 2 seconds of dusting and I'm going to end the procedure here. ¿Ya tenemos el doble J? Sí. Sí. Vale. Andrés, ya casi estoy, ¿ah? 5 minutos. Sí. Okay, so 1/3 of the screen. Listo, por favor, con el láser. Gracias. Just a little bit of extra, no hagas nada, just gravity. For popcorning, remember, just gravity. The important thing is then when you activate the laser, you have active irrigation to decrease the temperature. This is the important thing. You don't need to have manual or constant irrigation, but or let's say continuous irrigation. But if you have even gravity irrigation, constant irrigation, you will reduce temperature increases. So this is very important. I like only gravity. You have irrigation, you reduce temperatures, but you are not expelling the stones away from the scope. So this is also important to have a more effective, let's say, a more effective procedure. You have increase at maximum. I have increased at maximum the settings, 1 joule 20 hertz, so maximum 20 hertz to be on the safe side. So not very high frequency, is just 20 hertz, 20 watts, which is the important parameter. And I have as much energy as possible, which is 1 joule. And you can see here that with that and a long pulse modulation, you can have good, efficient popcorning very quickly. These stones are already less than or very similar to my laser fiber, which is, remember, 0.2 millimeters. Compa? Okay. Excellent. I'm very happy with the result. Here, Pompa. I'm going to check the lower calyx here. Excellent. So this is a very easy kidney. I don't need extra X-ray for this. We have done only one initial just to test the C-arm. No excessive X-ray. So this is very important. We have checked all the kidney. Okay, I'm going to remove finally my fiber. We put it into the exactly so it doesn't bother. I'm going to put my guide wire in the upper pole. Gracias. Remember you have to wet the hydrophilic guide wire always. It was very good to have the scope. It was very handy. It just moved the maneuverability, and the vision was kept all the time. You can see the excellent digital imaging. You can check the ureter always. There's no problems with it at the end of the procedure. It was great. So we're out. We know that our guide wire is, gracias, ponlo acá. Going to remove the suction. Quitar esto. Vale. Perfect. Now I have this on the table. Excellent. ¿Podemos avanzar un poco el arco, por favor? Pone el catéter. Avanzarlo un poco hacia las pantallas. Con el verde, exacto. Vale, perfecto. Y esto lo modificaste porque estaba al revés. ¿Sí? Okay, so we're placing the stent, 6 French 24 centimeter stent. Excellent. So put it like this. You can see the table is prepared for everything. I just grab it here, put it the whole thing over there. Vale, quita, suelta, suelta. Vale, haz una escopia, una sola. So just one. You can see that the stent is already in the upper pole. Dale una escopia, por favor. So we just need one tap. It's already in the upper pole. And to check the lower pole, sujeta acá. We can check it like this. So only 2 taps on the whole surgery to put the double J stent. You can see the cord here. Okay, I'm done. Thank you so much for tuning in. I think it was a great surgery to show all the efficiency of the Pusen 7.5. We had this. We had the good insertion by the 7.5, excellent maneuverability and excellent image.